The evolving nature of end-of-life planning for motor neuron disease patients and their families when ventilation is required. This video summarises research exploring how patients with motor neuron disease and their loved ones navigate end-of-life decisions when mechanical ventilation is in place. We will highlight some of the key things to consider and discuss with patients and their families. Motor neuron disease, also known as ALS, is a devastating condition that progressively weakens muscles, affecting movement, speech, and breathing. As the disease advances, many patients turn to home mechanical ventilation to support their breathing and improve quality of life. However, this life-sustaining technology may exacerbate complex end-of-life discussion and decisions. Research led by Dr. Eleanor Wilson at the University of Nottingham sheds light on these challenging decisions. In a recent 3-year study, she and her colleagues conducted in-depth interviews with people with motor neuron disease who were dependent on home mechanical ventilation and their family members. The team's findings revealed the multifaceted and evolving nature of decision-making in this context. Many participants expressed a reluctance to discuss end-of-life care. However, they might still make selective decisions about certain personal matters, such as updating or making a will. For people living with motor neuron disease who became dependent on home mechanical ventilation but didn't want to discuss end-of-life options, decisions were often defaulted to family members, especially once the patient had lost their capacity to communicate. This underscores the need for early discussions to explore wishes and concerns about the future and the legal aspects of decision-making, such as power of attorney. Some patients did want to make proactive decisions about stopping the use of ventilation, viewing it as a way to retain some control over their quality of life and timing of their death. As one family member commented,
"In one sense, Mum felt very much like she had control back in her hands."
Importantly, Wilson's study revealed that many participants lacked a clear understanding of the process and the legal right to refuse treatment. As another participant said,
"I didn't realise these choices existed. Having realised they existed, it's empowering."
It is also important to have discussions with families about what dying might look like, either with the ventilator in place or once it is withdrawn. The research also shed light on the experience of dying with ventilation in place. Some reported additional distress at witnessing ventilation being maintained whilst their loved one was dying. One bereaved family member commented,
"I said, is this ventilator keeping him alive? I'm so angry because that man could have possibly not been suffering for so many days if somebody had explained that to me."
This emphasises the importance of discussing and planning what might happen when ventilation is no longer offering any benefit. Importantly, the study found that patients' wishes often evolved over time as their circumstances changed. As one participant said,
"What I have learned is, don't make presumptions about what you can and can't live with and still enjoy life. When the time comes, you might feel quite different about it."
Healthcare professionals should be prepared to revisit these conversations regularly, always respecting a patient's right to change their mind. For patients who are reluctant to talk about death, there are resources to help clinicians broach these conversations. There are also a number of resources available to help patients and families understand the process and access support. By illuminating the complex factors influencing decision-making around home ventilation in motor neuron disease, Wilson's research provides valuable insights for healthcare professionals. It highlights a need for ongoing, sensitive communication, comprehensive patient education, and a flexible approach.